And welcome back. As viewers know, one regular feature of our program is a sort of show and tell, where guests bring in something, some item, could be a book, could be a photograph, who knows what. But it's important to them in some way, symbolic of who they are and what they're about. Doctors, let's take a look at what you brought. I'm going to start with you because I'm really fascinated to see what this is, Doctor.
This is a building built by a builder who was hurt, and he fell and suffered what we call a subdural hematoma, which is bleeding on the brain, and he required emergency surgery to save his life. So out of gratitude, he built this and then gave it to me. So this is a gift, and we cared for him during my chief year. That's the last year of training where you have more responsibility. So this was an important gift from a very special patient.
It looks like a hearth. So
it does, yes.
Like with a fireplace in the center. And of course, you know, a hearth is always said to be the center of a home. It's the heart of the home. Yeah. So seems like a very appropriate gift. So you were pretty pleased to receive something like that.
Very humbled.
Park, what have you brought with you today?
Sure. This is a picture of my father. When he was coming to America in 1963, he was just a newly graduate from Korea. He didn't really speak that much English, but he really had a desire to learn more and passion for that. So he came to America. That time he could not afford the airplane ticket, so he was on a ship that took 3 months to get here.
Wow!
And he went to Queens and did his residency over there. And I think he has the most impact on my decision to become a doctor, and not only become a doctor, but how you practice medicine, how you treat the patient, the art of medicine as well, right? So he came here not really speaking English. He was known as Doctor, I'll be right there, because on call, right? You know, he get a call from nursing station. They say something, he doesn't understand. All he can say is, I'll be right there. He hangs up and goes to the nursing station, right? And you start with that. But he has such a zeal for learning. He finished the program, and then he actually did a fellowship with Dr. Robert Good in Minnesota, where Dr. McIver came from. This was early 1960s when they were doing bone marrow transplant. And he was in the team, actually, as a fellow with Dr. Good. And he actually did the very first bone marrow transplant on the human. Yeah, so
wow.
Yeah, so he did really well with that, and then he went to UCLA, become a professor. And the second picture is while he's working at the UCLA, using the microscope and so forth. He did really well in immunology, and then he came to Buffalo as a full professor, right? And then actually he left me when I was young, 1 year old, came to America, and he actually invited me when I was 13 years old. So I reunited him in Buffalo, and there he really trying to tell me about the art of medicine. We had this long discussions at the dinner table. We call him Daddy's lectures, about how the patients did, and different Eastern versus Western philosophies, and how the difference between big man and small man, that kind of thing, right? So we did all of that, and one lesson he taught me that I still remember is that he told me there are 4 A's when you become a good doctor, right? He told me the first A is actually availability. So no matter how good you are, if you're not available to the patient, it does no good for the patient, right? Number 2 is affability. You gotta be kind and nice to the patients, right? Number 3 is affordability. In this age of insurance, maybe that's not so much, and then number 4 is the ability. Right? So what I got from that is, you really have to be available, not patient to colleagues, and everyone knows that, I give my cell phone number to my patients. Some people think that's a crazy idea, but I think it really gives them the direct pathway to a doctor, and I think it shows them that, the doctor really cares about them, And the other thing was that when my father was on the ship, right, he wanted to do 3 things. One is to learn English, which he did really well. Number 2 is publish some papers, right? And he did that really well. He actually published more than 250 peer-reviewed journals. He did really well. And then this is a book that he wrote with Dr. Good about textbook on immunology. So he's such a model and a legacy, and I try to leave some of the things he taught me to my children, which I'm having a hard time doing. Second person that affected him the most is my daughter, Yumi. She's my second daughter. She's now about 29 years old, right? And she has this wonderful smile, and she has the same smile now that she had when she was first born. So she has the fountain of youth, right? So how do you get that, And she had very special gene, right? So we talk about gene, all the billions of neurons and connections. Our body has DNA, which has billions of codes, right? That makes proteins, right? And she had one letter that was mutated by spontaneous mutation. So the protein that was to be made was truncated or shortened, so it's not doing the function they're supposed to do. And she was diagnosed with what's called Rett syndrome. RETT, Rett syndrome. It only happens in girls, 1 in a million. This is the kind of things that you learn about when you're in medical school in biochemistry, right? And a lot of times when things like this happen, it separates people, right? But I think really draws to come close together, as a whole family. So that was really wonderful thing. So past 30 years, I think really in journeying with her, I learned a lot. So I learned patience, right? And ability to respect, And I think in general, I became a nicer, more human person. So Yumi, even though she doesn't speak a word, she has a ministry. Her ministry is presence, right? So ministry presence, I didn't know about this, but then it comforts so many people, a lot more than I can.
Well, Dr. McIver, I wanted to get back to you for a minute. You came to Mercy from St. Paul, Minnesota, correct?
Correct.
Is that where you're from originally?
Originally from Maryland. Because of training, as many people do, we travel to institutions where we want to learn, and then many people stay in that community. So I trained at Mayo Clinic in Rochester, and we settled in the Twin Cities.
Now, I think even the general public knows the name, the Mayo Clinic. It's like right up there with Johns Hopkins and Cleveland Clinic is one of the best medical institutions in the world. What was your experience working there?
It was a wonderful experience, and the primary thing that we're told is that the needs of the patient come first. And so that's what everyone who trains at Mayo or works at Mayo hears, that the needs of the patient come first. And so I think that's a very important reminder each day, especially when things are difficult or patients are frustrated or you're frustrated, that the needs of the patient come first.
And that can be a heavy burden to bear because I'm sure you're dealing with patients who may have really quite serious conditions. How do you cope?
It's a learning process. I'm still learning and setting boundaries, because the default, I think, for surgeons in general, and especially for neurosurgeons, is to always be available and to give your best at work and to expect the best from everyone. So learning to accept that I have done my best. I'm not perfect. Patients appreciate what you do, and to accept gratitude as expressed by patients, and then trying to learn to take more breaks.
Well, Drs. Park and McIver, I want to thank you both for your time and your candor. I'm hoping our viewers enjoyed this chance to spend some time talking and hearing from you, and maybe learned a thing or two that they can apply to their daily lives. And thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. And until we gather again, May the road rise up to meet you. So you stay through the credits. I'm glad you did, because now it's time for Wait Doctor, I Forgot to Ask. This is where we discuss the question each physician wishes their patients would ask but don't, or the most unusual hand on the doorknob question posed by a patient at the end of their visit. Dr. McIver, we'll start with you. What is that question?
It's what question would I have hoped that the patient would have asked?
Okay.
That question is, who's in charge here? Most patients, if not every patient, comes and assumes that the physician or the nurse practitioner or the PA is in charge, but really they're in charge. And with that responsibility, they have to understand, or I want them to understand, that there's something that they can do to change the course of their condition. And in the Patient Bill of Rights, there's never anything that says, this is the patient's opportunity, this is the patient's responsibility. It's usually one-sided. But when a person comes to the physician or the nurse or the PA, it's really a team, and both have responsibilities.
Dr. Park?
So usually when we talk about different surgeries and so forth, I sit there and ask them all the questions. They ask me all the questions. And I always say, do you have anything else you want to ask me, right? And a lot of times for young people, they have a smile on their face, says, when can I have sex? I said, well...
all in good time.
All in good time.
All in good time. Mm-hmm.
Right, I think that's the most unusual kind of questions they ask. But most of the time, I think they really understand surgery and expectations and so forth.
Mm-hmm. And here's the question I forgot to ask. What makes a great neurosurgeon?
I think it's taking from what Dr. Park shared about his dad's 4 A's, and the first was being available. And I interviewed at the University of Chicago, and there was Dr. Bryce Weir, who was a famous vascular neurosurgeon. And he was the chair, and he told me, what makes a great neurosurgeon? Is being available, being able, willing to get up out of bed when someone calls for help to take care of a patient.
Well, it's funny you should say availability, because when I used to teach at Loyola University, PR students, I made that same point to them, that as a PR professional, the most important thing is you need to be available to the media, because when they call, you need to be accessible. You need to be able to respond to that call, because that's how you build relationships. And you talked a little bit about relationships, Dr. Park. You've got to have those relationships, because if you don't, you can't function in your field. So, there's that famous saying that really most of life is just showing up. So being there, so I think that's important. Dr. Park, what do you think makes a great neurosurgeon?
I think the chief quality is humility. Because as you said, there's trillions of connections in the brain. We don't know exactly how everything that we do actually affect the patient. We know to a certain degree we do know, but it's understanding that we do what we do, but still be humble. Because neurosurgery, Dr. McIver will tell you, will make you humble, right? And along with that, I think comes wisdom. The best definition of wisdom I heard is the competency, to the complex reality of life, right? So if you understand that, everything, I think we'll more understand the nuances of dealing with the patients and doing the surgery, because, what we do is a very small part of a patient's life. It's a major, in a sense, that at that point, but overall, so I think we have to look at the whole thing, be able to, again, look at the complex reality of life, right? Because life is not simple, and you only need to approach it with the humbleness and with faith.